In AccuDent, let me show you what we have on the left side. When you click on AccuDent, you automatically come to the diary. You can manage the diary directly, and I will show you how we set up the settings. Then you have the patient list. Directly here, when you click, you have all your list of patients. You can search a patient by anything containing in the name, in the first name, or the full telephone number. Then, if you open the settings here, you will have the practitioners working in the clinic. In this clinic, we have two practitioners, Arshad and Ursula. By default, we will go to Arshad. We can edit or delete a practitioner. When we edit, we will need to get his signature with the stamp from DHA, the name, the qualification can be implemented, the phone number, the fees password, because he will get access to his personal fees, the email of the practitioner, and the license number, which is required in several documents. We can get the bank. So the bank can be the private bank of the practitioner or the bank of the clinic. This is to deliver and to deposit checks. And we can select what kind of communication it's going to do by SMS or by email or by WhatsApp if he has a WhatsApp business account. I save this, and now we've been doing the details in the settings for the practitioner. Let's go to the clinic. The clinic profile, you have the logo of the clinic. You have the stamp signature of the clinic also. The clinic name, first name, family name of the owner of the clinic, the address, the state, all the details that we need are here. Okay, we can save. We save that. So now we go to the next one. It is the procedure. The procedure is all the list of what we are doing. We have been doing several families like dentistry, chart, diagnosis. If you click on diagnosis, you will have all the diagnoses which are proposed with the codes, with the nomenclature name, with the procedure, if it's procedure or anything else. And this is the number. So we can check by number, by search, and you have all the details of what we have here. In details, when you click on this one, you get the under 3 years oral evaluation, and you have that, it's and you put the price. So this needs to be implemented by you for all the different procedures that you will use. When there is a background like this means that the procedure is not active, it is inactive because we don't use this. So when the procedures are done, you can go to My Procedures. My Procedures will allow you to set up your own procedures. So for Dr. Arshad, he will have in fillings, he is doing these fillings: composite occlusal antérieur, mesial, distal, buccal, MOD, and all that. These are all the fillings, the sealant and all that. So if you go to fix, he's using temporary crowns, zircon crown, chrome cobalt crowns, and these are inlays, are inlay metal occlusal, or here it is inlay composite. Let's say this is the kind of fixed prosthesis, or you see here a post and core indirect system. So this is what you will set up for your own things that you work in your, the type of you work in your clinic. So this is called My Procedures. So we've been doing the settings. We go to utilities. Utilities is the way you are going to manage your clinic. You have a medical questionnaire. So in the medical questionnaire, there are some questions that you cannot change because this is mandatory, done by NABID. And if it's not enough for you, you can add some of them. So let me organize by allergies. So this is in the questionnaire. All these allergies are mandatory by NABID. This is the dental. Dental is how the patient is coming to you with all the dental questions that they are asking to you to solve. This is the medical, in the medical questionnaire, with the heart prevention, anticoagulant, heart pathology, so all that. And you have now at the end the vitals. Okay, so all these you can add a new medical questionnaire easily. List of medicines. The list of medicines is all the list that you have in AccuDent, and of course you can add more if needed. I show you something like a augmentin, this one. I can edit. When I edit, I have the name, augmentin, 650 milligrams. This is for mild infection. You can add that. This is for you. And then this is for the pharmacy, augmentin 650 milligrams in tablets. And this is the wording that you will see in the prescription. You can add some comments, you can add some interactions, and you make it active or inactive. You can update that. So doing this, you can update new medicines. And again, you have some families of medicines. You have adjuvant, antalgic paracetamol, antihistaminic, antibiotics, antifungal, anxiety, balm for first teeth, blood, dry mouth, herpes, hygiene, and most prescribed because DHA and NABID don't allow you to make a preset prescription. You have to add one by one all the medicines in the prescription to get a tracking on NABID. Because of that, we've been editing the most prescribed. So the same medicine can be different places in antibiotics and most prescribed. And using that, you will open only one list, and one by one, you will be able to edit your medicines. This is for medicines. Let's go to procedure type. Procedure type is what you are doing. You are working on care, implantology, or prosthesis. This is almost what all the insurance companies are dealing with. So this is the type. Let's go now to manage the families. The families are based on different kind of analytical. What is analytical? It is the list of things that you refer to when you analyze your procedures. You have the contact details like vendor, specialist, practitioner. Of course, you can add more. You have the medicines. Okay, this is the family of medicines, all the families of medicines. You can change that if you want. And you have the procedures. Okay, all these are in procedures. When you look for procedures in implant, you will see all the implant procedures. So you can update or you can search and you can find easily. So the next one is insurance companies. We've been editing a certain number of companies, but you can add more. And also what you can do, you can, in some example, you have different ADNIC. You have ADNIC number 1 with a certain number of fees. You have ADNIC number 2 with another number of fees, because getting the ADNIC insurance, your patients will not have the same kind of fees based on the quality of the insured people. So you can add ADNIC 1, ADNIC 2, or make any comment on that, and you can add as much as you want. So based on this, we will set up a preset claim form, exactly the same as what they give to the patients to fill, and this will be filled automatically for all the insurance companies. Manage analytical, so this is what? This is the questionnaire that you have to send on the statistics. So this is all what is included in the statistics in the family GP or perio or prosto or diagnosis or implant, endodontics, orthodontics. All this is in the different families that they request in the statistics number 15. Manage layout. Manage layout. I will go to this in a particular way. This is the way to write a document and you have a certain number of tools there. So I will explain that to you. And you have a certain links that you are preset, like the logo of the clinic, for example, and you work on the clinic, on the patient, on the contacts, on the contents. All this will allow you to preset all your forms in a very simple way and very efficient way. Right now, I just tell you that it is here, and you will get more details in another movie. So I go to the contacts. In the contacts, I have my list of contacts, sort by type of contact, specialist or X-ray or whatever it is. So you have that, and you can edit this. And you can link them to the emails that you are doing. There is a special link for your contacts when you are sending emails. The diary, these are all the details of the diary. In a special movie, I will show you how to manage the diary, the activities, the appointment types, the markers, and the events. So all this is possible, and you will be able to do it working on the diary settings. The statistics, I have several movies on the statistics, on 19, 37, 38, 39, which are the same, very easy to manage and very fast. Now you have the SMS credit. Here, in this case, we have no SMS, so we need to buy a credit. We click on request, and we can buy credit of SMS, and we do exactly the same for the SMTP. The price of email will be around 0.7 fils, so it's very cheap, but very secure also. This is for security, not to send emails which are going to spam. Now we have the reports. We have the income. When I click on income, I need to edit a password to get access to the income. I have the income. So based on this, Arshad, I have the name of the patient. They have been paying. This is a reimbursement. All this is the list we can print and give to the accountant. If you have the owner of the company, not only you can get the income for yourself, but you can get the income for all the people, all the dentists working in the clinic. Here you have two dentists, Arshad and Ursula. Ursula made nothing. Arshad made 5,500. And if you have a payment done by an insurance, it will come here automatically. So you can print again and send to the accountant. So you have the pending payment to check who is owing money to you. So you have the details here with the invoice linked to the money which is required, the patient's name, the amount the patient needs to pay, and the total. And you have the full total of the payment which is pending. So you can manage your payment for yourself, and you can manage your payment for all the clinic based on only Arshad has a pending payment. If Ursula had a pending payment, it will come here also. Now you have the last one, which is the reports. The report, you make a report, and this is very useful for the patient. For example, tomorrow, I want to make a report on my appointments. And this is the list of the patients that will come tomorrow. And this will allow me to open the paper file of the patient, in this case, number 1 and number 3, to give to the practitioner at the time the patient will come. We have also a special report on the VAT. The VAT, you can classify the VAT by number 1, 2, 3, 4. Nothing is missing, and some of them are void, not deleted. We never delete an invoice. We need to track all the invoices, and some are posted and they are validated. And finally, the end of that is the tutorial. When you click on tutorial, you have all the details of what you need to know, and you can choose by working on the diary, working on price list and procedure, working on statistics, movie on the statistics number 15, and all that will be available from the left side of AccuDent. I thank you for your attention.